This is Dr. Patty, and I want to thank you for joining us this evening for the webinar. I know that people will continue to join, but we like to get started on time, so here we are. I'm going to cover some basic detoxification protocols today, which work for weight loss, cholesterol, diabetes, and inflammation. And giving you these protocols, I'm giving you some very basic protocols that work in 85 to 90% of the patients that we see. There's always modifications that we sometimes make based upon individual variations, but I can tell you that they're basic enough that, you know, and any of you in this field obviously knows that there's so many different things you can do for detoxification. I think it becomes quite clear that there's many different ways to do the same thing. We've been using this method for about the last 7 years, so we have a reasonable idea that most patients are able to do it. A great number of our patients go through this, so this is not something that we use in a small number of our patients, but in a very large percentage of our patients. And the majority of those patients are able to follow these protocols. When I say the word basic, it means that basically not only is it simple to follow for a patient, but also it's reasonable to utilize this kind of detoxification protocol for almost anybody, even without getting necessarily a lot of lab tests to see where their intestines and liver and so on are. So I'm going to get started. Let's see here. I guess I have to figure out how to flip the slides. So most of you may know that you know there's a protocol that I've been using for the last 7 years that developed over time, starting with modulating hormonal protocols, then realizing that we needed particular nutrients to activate these hormones. For example, particular levels of vitamin D to activate thyroid. But what was really the revelation was when I realized that unless the bowel and the liver are actually working, the hormones and the nutrients don't ever achieve 100% efficacy. And that's where some of these protocols started to get developed. And of course, they've been refined over time. I'm having a little trouble switching this. I can't. Okay, here we go. This is perfect. So the first thing I need to share with you is that there's really 2 steps for detoxification. One of them is going to be to reduce the toxic burden. And when I talk about the toxic burden, I'm talking about inhaled things like smoke, gasoline, paint, glue, cleaners, painting our wall, putting a new floor down, alcohol, pesticides, which include, you know, depesticiding our homes, and also the food that we eat, preservatives and dyes, which may be in our food. Petroleum-based skin products, you can pretty much be assured that even most of the products that are labeled as organic have petroleum-based preservatives in them, and we know that the skin absorbs better than what we put in our mouth, so that becomes an area to reduce. Any kind of animal products which are more immunogenic, I'll be covering that a little bit later. Heavy metals, electromagnetic fields, viruses and parasites. So the concept, of course, is that there are many toxicities. There's a list, and actually this webinar and the slides will be making it onto the website for MD Prescriptive, so you'll be able to see it. But there's different kinds of toxins that cause different kinds of things. We know that, you know, even caffeine, which stimulates bile production, depletes the liver of essential nutrients that are needed for phase 1 and phase 2 detoxification. And alcohol stimulates the E1 receptor sites. And we have formaldehyde that we can get even from decaffeinated coffee that impairs phase 2 liver functions. So you'll see that there's a lot of things on this list. We know that pesticides stimulate the estrone receptor, phthalates, bisphenol A, which come from plastic foods, plastic bags, Ziploc bags, even baby bottles. You may know that this has been banned in Canada as of last year, but we still have this problem. And these all bind to E1 receptors and also to brain receptors. So you'll find a list here with some major toxins and what their effect may be. Heavy metals displace lighter metals and lead to osteoporosis, dementia, cognitive decline, and arthritis. And of course, there's the electromagnetic radiation coming from cell phones, computers, Wi-Fi zones and cordless phone bases that not only affect certain glands, the glands they affect the most are thyroid and ovarian function, but they also disturb all our neurological alpha and delta waves, and they're linked to brain dysfunction and even some tumors. Chlorinated and brominated products which displace iodine and cause low thyroid states. It's a picture that I took in India. You know, people go through a lot of trouble for clear water, and we know that water is the major part of the body, so that becomes one of the most important ingredients in detoxifying, is to get pure water. This happens to be a list of things that are from the National Cancer Institute as being potentially carcinogenic, and by the way, these are all normal approved additives to our skincare products, so these are the things that we want to be careful of. Electromagnetic fields that vary from anything from the ionizing radiations to non-ionizing radiations. And I won't be talking much about how to detoxify ourselves from electromagnetic fields, but I can tell you that the part of this that we have control over is distancing ourselves, in the sense that when we're sleeping at night, that 8 hours that we're spending in our bedroom should be in a Wi-Fi free zone with no cordless phone next to it. Cordless phones give off very high gigahertz and milligauss as far as electromagnetic radiation. Cell phones, laptops, things like that. This is the invisible energy that's hard to get away from, but there's certain things we can do to protect ourselves. And therefore, step one is basically to just reduce the toxic burden. Step two is to optimize the body's detoxification process. And we know that the body's detoxification process occurs optimally when the tissue pH is greater than 7.0, which is basically an alkaline pH. We achieve this pH through increase in intake of our plants and increase in oxygenation through deep breath and exercising and circulation. Let's see now. Why is this not going to the next slide? Okay. The next thing we know is that our body has a reasonably intricate system of detoxifying and getting rid of toxicities. We have the liver, which has phase 1 and phase 2 detoxification. That includes a lot of steps like putting hydroxyl groups and methyl groups and sulfation so that the body can safely get rid of things. And we know, of course, the liver activates the thyroid testosterone. We have the bowel, which when the liver dumps toxicities into the bowel, we expect the bowel to move 3 times a day. And if you look at an infant or a pet, it becomes clear that moving the bowels 3 times a day is actually one of the ways the body gets rid of toxicities. And if it's anything less than that, we start to reabsorb that and put that away into the fat tissue. Interestingly, the bowel produces glucuronidase when the bowel flora is off, and glucuronidase deactivates the glucuronidation that phase 2 liver has put onto, for example, estrogen. So if you have an estrogen that's glucuronidase, that has a glucuronide molecule on it, the body can get rid of it unless the bowel flora deactivates that, and then the harmful estrogen is actually reabsorbed back into the circulation. So there's many pieces to the bowel, and that's why this detoxification I'm going to tell you about is focused on bowel and liver. And then we have the lymphatic system, which drains the fat tissue. Fat tissue is a very high concentration for toxicities, and we know that the fat tissue drains into the lymphatics, which are suppressed if we wear, for example, something simple like elastic on our body, whether it's a pair of underwear with elastic or it's a bra. So these things suppress lymphatic drainage. Lymphatics drains into kidneys, skin. We know that this is a simple example and a list of some of the methods that the body uses to detoxify toxins that enter the body, and these are the areas in which we work to help the body optimize detoxification. We know that increasing the pH has to do with limiting fish, dairy, coffee, tea, and flour, and avoiding exercising in the cardio range for too long, which means that basically if we're above 5 minutes in the cardio range, we end up going into anaerobic respiration, which is going to produce lactic acid and decrease the pH. So we have to keep ourselves in an oxygenated range. That's the best way to increase the pH. Increase the vegetable intake, increase the water volume. And there's many different forms of foods that are actually alkaline, which we recommend people eating during these kind of detoxification diets. I'm flipping through these slides because they're self-explanatory in the sense that the more vegetables we eat, the more apples, the more berries, the more sea salt we eat, the more alkaline we are, and the more meat and fish and alcoholic beverages and soy products that are unfermented that we eat, the more acidic we're going to be. The agenda for today is going to be to go through, one, the basic bowel and liver detoxification that we're using to treat high cholesterol, diabetes, and weight gain, and then the variations for high-level inflammation and disease, which include plant-based emphasis and superfoods. So that's basically what we can expect to cover today. I'm going to give you a simple case that might help you to understand some of this. This is a 52-year-old woman who came in complaining of weight gain, and as you can see, her energy, her sleep, her sex drive, none of them are where they need to be. And one of the things that we have realized is that before we ever address the weight, we have to get the person feeling better. And when they are feeling better, we know that the metabolic hormones and the metabolic system is actually in a good enough place for them to detoxify. So we never take anybody through any kind of detoxification process unless they're feeling reasonably well, which in this case, for this woman, involved basically, what am I trying to say? Which basically involved correcting hormones and nutrition. So what I'm trying to say is timing is very important, and we do need to wait until the patient is happy. So in her case, it involved using some hormones, some nutrients, and by week 4, she was feeling quite a bit better on the energy and the sleep issue, and that's when we started the detoxification. What we were trying to achieve in this case is we were trying to achieve metabolic balance. We were trying to bring her fasting insulin down from 11 to under 5, her fasting blood sugar into the 70 range, her hemoglobin A1C into the low 5s, and her triglycerides to the 225 range, from the 225 range down into the 100 range. So this is going to be an example that will exemplify not only weight and inch loss, but also the correction of a hemoglobin A1C and high cholesterol. The slide that I'm showing you is the blue line is the desirable variation in our insulin and sugar levels, and the red line would be what happens when we are in a state of insulin resistance, which happens to everyone over time, where we swing up high, swing down low. Up high, we're storing fat in insulin-controlled areas. Down low, we're having either fatigue, dizziness, sugar cravings, such and things like that. So I want to show you a little bit about what the first 6 weeks of the program looks like, and I want you to understand that this program, we generally, in many people, continue for 12 weeks, but the first 6 weeks is a little bit more organized in the sense that we start with a bowel cleanse in week 1. And the thing to remember is that you always have to start with the intestines before you go to the liver. Because if you correct the liver's ability to detoxify, the liver is going to dump into a bowel. And if the bowel is only moving once or twice every week, which if you question your patients, you'll find a lot of them actually have that situation, you won't be able to move those toxicities. So we start with a bowel cleanse and do not add the liver cleanse until week 4. In this program, there are some things that, some educational pieces we teach them, some exercise pieces, but the crux of it is dietary and some supplements, which I'm about to go through right now. We start in week 1 with a 7-day vegetable cleanse, and the purpose of this vegetable cleanse is both to alkalinize the body and raise the pH, and to reduce the digestive load. The indications for this are, we have some patients who do this seasonally, a couple of times a year, but we also use it as part of our metabolic balance program to lower cholesterol, insulin resistance, weight, and all 3 of those are achieved with the program. There are some things to avoid, and this has to do with the theory of reducing the burden on the intestines. All meat, fish, dairy, eggs, because they are acid-forming and they increase the digestive burden and the byproducts. all sugars, alcohol, soda, tea, coffee. And we ask the patients to minimize canned, boxed, processed, refined, overcooked, and microwaved food. So the idea is to eat vegetables during this first week. I've highlighted the yellow, the vegetables that increase phase 2 detoxification by providing more methyl groups and more sulfur groups, which are part of the process. And of course, we know that if we have somebody who really has a phase 2 detoxification issue, it's very difficult to get that quantity of methyl group and sulfur group from these vegetables. But we basically instruct them to pick from these lists. They are allowed legumes and beans, chickpeas and lentils up to 3/4 cup cooked, combined with 2 cups of vegetables cooked. But they can cook them, they can eat them raw. We share different kinds of vegetable soups with them. My favorite one is the garden vegetable one, where they just basically take all the vegetables from the list they can and add tons of garlic, tons of onion, tons of ginger, and basically cook it in a pot, add some salt to taste, and I like to add the sea salt. The one I like to use is Premier's pink salt, which you'll actually see later on in the presentation. And then either puree it or don't puree it, and it makes an excellent soup. And we suggested them to make roasted vegetables and salads and keep as a backup organic V8 type juice. But the idea is that there's absolutely no calorie restriction during this time, but that they prepare the foods on one day, maybe a couple of them, so that they can keep rotating them through the week, so that they never have. The biggest thing in this is to be prepared and not get to a meal and not know what you're going to eat or what you're going to do about food. The tips, of course, is be prepared, make several recipes in advance and rotate, make a 7-day meal plan, carry a very large purse or bag or backpack for men, water and Tupperware with food and a cold pack. And what we tell them during this week is don't focus on the things that you did not do well. Congratulate yourself for every success. And that is really the focus of any detoxification program, because these are programs which your patients will struggle with, and it's important for them to understand that they should pat themselves on the back for everything that they did right, rather than focusing. You'll see these patients come back and said, oh, I didn't do it all the way, I didn't do it completely right. So I think that part is really important. And the 7-day meal plan has to include 6 meals, breakfast, lunch, dinner, and snacks in between. And rotating the meals sometimes helps very much. We ask them to drink a water volume of half their weight in ounces. We ask the family to participate rather than having somebody who's cooking or somebody who's eating in a family where they're the only ones. We've had many families turn their entire lives around just by doing this veggie detox. You know, really continuing with some of the positive things they've seen. We ask them to put themselves first, get outdoors, breathe. It's really, the encouragement is not to stress over the details, but to try to make this a life-changing, lifestyle-changing methodology that will enhance their detoxification really for life. Some of the bowel cleansing products we use at this point, we use a Pure Cleanse Bowel 1, which is mostly herbs, and a Pure Cleanse Bowel 2, which is mostly fibers, and then a probiotic that covers the upper and the lower gastric system. We ask them to take 1 of each at every meal. So they're taking 3 capsules or tablets with each meal 3 times a day during this first month. And this is the product. It's got a ton of different things in it. Most people tolerate this. And actually, I should show you that this is also the regimen that I use when somebody comes in and says, I'm constipated and I'm interested in getting their bowels retrained. I usually use this for a month or 2, and once the thyroid is corrected, I get them off of this particular mechanism. If you look at different companies and what kind of products they have, I would say that out of the products, we've been using this product for over 5 years. So this product is definitely something that we've had excellent success with. The probiotic has 13 different organisms and prebiotics in it, which allow us to have a good coverage of both the upper and the lower intestines. If you look at different products that are available, you'll find that, it can get confusing. I'm always looking for something that covers the upper and the lower intestines, and you can see from this slide and the next slide that you have a pretty good coverage with this product, and and it works, so that's one of the reasons why I use it. Now, when I start to go to week 2, we follow these patients at week 2, and I say week 2 to life, because they can really follow this eating mechanism all the way through, and it's an excellent way to eat. Again, the focus is on celebrating every success that they have. We do have a weekly questionnaire that has a total of 25 points that you can use. We don't end up having to use it, but it's encouraging them to increase their water intake, and they get 3 points as if it's above 60 ounces, increase the average number of meals and snacks per day, increase the number of different vegetables they ate this week, increase the number of conscious breathing per day, the number of bowel movements per day, and the new recipes tried. So the total amount that they can get, and the exercise per week. So if they exercise 7 days per week, they get 7 points. This is just a way of them following. It's a point system which they can follow to gauge themselves. It's really much more for themselves than for us. But many patients find that to be extremely useful way of organizing the way that they're doing things. Again, we're looking to correct this, and the fact is that during this week, by adding and matching the proteins with the carbohydrates, this is when we're able to bring the red line back to the blue line by complex carbohydrates and protein links. And the first thing is that the vegetable cleanse that they did in week 1 already changed it. The new plate ratio that I'm about to show you changes it the rest of the way, and also the supplements, of course. So when I talk about plate ratio, the mechanism that we recommend for them is that for every single meal, whether it's a breakfast, a lunch, a dinner, or a snack, that they keep themselves at 50% vegetables, 25% protein, 25% complex carbohydrates. I'll give you an example of a breakfast with this meal plan. You can eat 1 egg under the 25% protein, 1 cup of steel-cut oats under the 25% complex carbs, and give yourself either some kind of sauteed vegetables or a glass of veggie smoothie, or if you're really in a rush that morning, take a glass of V8 type juice. That the one we use is from RK Nuts and organic variety. The only problem with this is they are pasteurized, and that's what I don't like about them, which means the enzyme activity of them is not what you really want. But just, you have to make these things realistic. So we have several different types of things, but the idea is that they use this plate ratio for every single meal. This is an excellent plate ratio for meals in general in terms of the rest of their life, because this is a meal ratio that will always balance the insulin profile out. We encourage them to eat 8 servings of all different colors, because every phytonutrient of a different color stimulates a different organ. We ask them to use a lot of herbs and different kinds of things to spice the things up. As far as protein, we do prefer organic, obviously, because when we're detoxifying, and actually that's how you keep the load down, hormone-free, antibiotic-free, organic. There are all kinds of good choices here. You may know that if you have grass-fed meat, the omega-3 to omega-6 ratio is 10-fold higher for omega-3 than if you have something that's been fed, corn-fed or soy-fed, which many of the animals are. So this is the focus, lean protein. When I say good egg, bad egg, that's exactly what I'm talking about. A grass-fed chicken is going to have an omega-3 to omega-6 ratio 10-fold higher than a regular egg. And then we have a whole list of vegetarian proteins which are focused upon lentils, legumes, fermented soy products such as miso, tempeh, and natto. We teach people how to use different types of grains. The reason why you want to go for whole grains is because you have all 3 parts of the grain there, the bran, the germ, and the endosperm. This means that you have enzymes, you have active nutrients. And also we, of course, recommend that people try different ones. I don't know how many of you have ever tried using different kinds of grains, but the taste can vary quite a bit, and there's a lot of recipes that we have. We're actually coming out with a recipe book in the 3rd quarter of this year, which will give us some of these recipes and be available for people. But I think that people are very surprised by what they can do with the different kinds of grains and the different kinds of complex carbohydrates that are in that quarter of the plate that we were showing you. We recommend that people not only use a lot of legumes of different kinds, but they learn how to sprout these grains and beans, because this increases the digestibility of it and increases the enzyme content by a great deal. It's extremely easy to sprout. There are nowadays all kinds of little packets you can buy to sprout, but I'll tell you my favorite methodology is to get a bowl, put the lentils in the water, change the water every day. Within 2 days you usually have sprouts. You can drain the water, stick it in the fridge. And so then you basically can use this to sprinkle on top of your salads and your fruits and everything else, and you have a very nice source of enzymes and nutrients here. We obviously recommend that there's some fat, and we teach them the difference between good fats and bad fats. We recommend quite a bit of avocado, coconut, and coconut oils and so on for cooking, but the main aim is for them to keep their plate exactly at this. By week 4 is when we start the liver detoxification. Now, what you have to realize is just what we've done so far has already started to detoxify the liver, because they're generally utilizing a lot of those vegetables that automatically give you natural sulfurs and natural methyl groups. But we do enhance that with the Pure Cleanse Liver. At week 4, the recommended dose of 2 capsules 2 times a day. I often will use 4 capsules 2 times a day to try to get this to a higher level. For that 1 month, we only ask them to use 1 bottle of this. And what I will tell you in a moment is that we also generally add to this Pure Greens, which is another product I'll show you, which can enhance this activity. But you're always looking to keep the number of bottles and supplements in these detoxes to a minimum, because this is what the patients see as the major obstruction to doing detoxes. And there's a fine line between doing everything and doing something that's realistic enough to be successful. There are a lot of different products on the market for liver cleanses, and I would say that this formula pretty much covers all the bases that we're looking to cover within a better price range than most of them. So you've seen what we do for the bowel and the liver, but I do want to show you what we added for this patient for weight loss. There's 4 supplements that we added. One of them was Gluco-S to control the glucose level. The second one was Ervingia to modulate the leptin receptor. The third one was conjugated linoleic acid to increase fat metabolism, and the same with 7-keto-DHEA. The Gluco-S product is one of the products, I would say this is probably one of the strongest glucose control and insulin sensitizing products currently on the market as a natural product, because it has all of the ingredients, the gymnema, the fenugreek, the cinnamon that we're looking for, and the bitter melon extract. I've had many diabetic patients either come very much down on their insulin requirements or their metformin requirements using this product. But we always use it when there's a weight loss issue in these patients that we're detoxifying. And you can see that compared to a lot of other products, this is a little bit more wider in range and dose than some of the other ones. The second product that we've been using is Ervingia. And although the studies have shown in this that the patients could lose as much as 28 pounds in 10 weeks, I find that to be not fully accurate. I would say that they do lose the weight the Ervingia adds to the mix. And if I have a patient who comes in and tells me, well, I just want to get started on something right now while you're doing the other things before I start the detoxification, it's Ervingia that I generally would give them. It works on the leptin pathways. Conjugated linoleic acid is another one of the supplements we use 3 times a day. And 7-keto-DHEA, which is coming from Pure. It's a vegetable capsule. It doesn't have any additives to it. And that's the one that we're using for, and actually that is the wrong picture. We're using 7-keto-DHEA at 100 milligrams twice a day. Just to show you in this patient the results that were achieved using this particular regimen, but in her case we did not use the Ervingia. But by week 12, her fasting insulin had come from an 11 to a 5. Her fasting sugar had come down a little bit. The most notable things are the hemoglobin A1C came down from 5.7 to 5.3, and the triglycerides from the 225 to 115, which basically is one of the strongest cardiovascular risks that she had. She also lost some weight and some inches, which I can tell you that in this detox mechanism, the results from over 500 patients show a reduction of disease risk factors in general, about a 20% reduction in total cholesterol, a drop of triglyceride of about 50 to 100 points. These are average numbers. A hemoglobin A1C drop of about 0.5 points. We found in 12 weeks an average of 15 inches and 15 pounds, and mainly a change in body shape. The pounds sometimes actually increase because of increased muscle mass, because there is an exercise program that we add to this, but I can tell you that you will find the numbers that I'm showing you up top are there regardless of what kind of exercise program that they have. If I have a big cholesterol issue and after doing this entire program their cholesterol levels are not where they should be, because after all cholesterol generally goes up because the bowel and the liver are not processing cholesterol the way that they once did. So if we have a patient who needs additional cholesterol support, there we will add Cholestex, anywhere from 4 to 6 capsules a day. This product was specifically designed for statin-intolerant patients, which end up being about 30%, or those who refuse to take statins. The results are about a 50 to 75 point drop in total cholesterol, and sometimes even more. I'm giving you average numbers, and an LDL drop of 20 to 50. When we combine this with using thyroid and things like that, the drops are much more significant than this. So for a lot of patients, this ends up doing the job. And we actually have a study going where we'll be reporting results within probably the end of this year on this product. But the one thing I do want to point out with this is that the red rice yeast here is within FDA standards at this point, which doesn't allow concentrated extracts anymore. So this is not a concentrated extract, and it still works because it has the other things in it that are very strong. I want to show you that. So that's the basic program. Now, when we have patients with high inflammation, and I'll give you a list of where that's appropriate, we use the exact same program that I've just outlined above, minus the weight supplements, unless they're there for weight, but we utilize it with the proteins being from plant-based sources, and we add superfoods to it. So let me give you a list of the patients we've successfully used this in. Patients with fibromyalgia, patients with psoriasis and eczema, patients with arthritis, irritable bowel syndrome, Crohn's, and ulcerative colitis. Many patients coming off their medications are having basically no recurrent outbreaks with this kind of a diet. And any high inflammatory state, high blood pressure, high C-reactive protein, low antioxidant function on SpectraCell functional intercellular analysis, which is one of the tests that we use. And you can see, I'm just giving you an example of what this looks like, but this is basically a before and after for a patient who has high inflammation and low antioxidant function, and this is after the program. So this is one of the parameters we follow. CRP is another parameter we follow, and the most important parameter is, are you in pain? Are you having, outbreaks? So basically for anybody with high inflammation, we use this plant-based superfood type program. And what does it consist of? The basic recommendation is that the majority of your diet comes from plants, as we showed you with the plate. You may know that the China study, which was published many years ago and a book came out a couple of years ago, revealed to us that the effect of animal proteins is to increase degenerative disease in humans. This is a simple example of casein, which comes 87% of milk protein is casein, and with 20% casein, we have an increased proliferation of cancer foci, and compared to 5% casein, which is much lower. So casein is definitely immunogenic. It's not because they're allergic to it, but because it provokes the inflammatory response in the gut, which starts the inflammation and starts the degenerative conditions. This is just an example of a 9-year-old boy whose eczema and weeping lesions were corrected almost 50% just by removing dairy, and then 90% by removing meat, fish, and eggs. And once the bowel was back to normal, we actually started him back on some products, and he doesn't even come back into the office. His parents do, but he's doing perfectly fine. Just a few revelations from this book. A plant-based calorie does lead to less weight. The Chinese population mass for activity level ate 30% more calories, but were 20% lighter. And if you look at the general trend that was found, plant-based diets were associated with less diabetes, less stroke, less autoimmune diseases, less arthritis by a significant amount, and less heart disease, to the point where the reversal of atherosclerosis in the vessels matched surgical interventions. And even the Cornell University and the Cleveland Clinic have adopted this mechanism to reverse vascular disease in patients who have significant cardiovascular conditions. Just a FYI type thing, the nutrient composition of plant and animal-based foods, from 500 calories of energy, if you look, the plant-based foods, an equal combination of tomato, spinach, lima beans, peas, and potatoes, has 33 grams of protein, and an equal match of animal-based foods has 34. So you're really not talking about that much more protein coming from animal-based foods, and especially when you calculate in that 30% of your energy in your gut is utilized to utilize the proteins in an animal-based product, whereas in a plant-based product, most of the energy is spent utilizing, is actually utilizable. Much more beta-carotene, much more dietary fiber. Even iron is 10-fold higher in an equal volume of plant-based foods compared to animal-based foods. Much more magnesium, much more calcium. So we obviously are talking about plants having more nutrients than animal foods. To this diet, we generally add superfoods. There's a book by David Wolfe called Superfoods. If any of you are interested, it gives you a great idea. What superfoods really are foods that are dense in phytonutrients, and with this density in phytonutrients comes a increased ability to reverse and restore antioxidant function and poor C-reactive proteins. We actually recommend that people get used to using superfoods in their daily regimens and incorporate somewhere between 5 and 7 of these superfoods into their daily regimens. It doesn't have to be the same every day. But for example, I generally have some raw organic hemp seed in pretty much anything I eat. I always take a little bit of aloe, always take a little bit of acai juice. So you always want to get some amount of some of these. Most of them you want raw and organic. As soon as they start to be heated above 117, you're going to lose the phytonutrient structure, and you're not going to get the same out of it that you got before. The purpose of the plant-based diet is to alkalinize the body. And the indications are as listed before, the ones that I had also listed. And I actually, in that list, I had forgotten, but anybody with a sinus condition, hives or rashes, has an intestinal issue. And when you start to correct the intestinal issue, not only are you going to correct the immune system, but you're going to get rid of these chronic conditions that they have. It's a 2 to 3 month duration diet. There are people who stay on these kind of diets. There are people who adopt them 85%, 90%, 60%. We recommend that people try to stick to them for 2 to 3 months, and then we're giving them enough knowledge that that's their knowledge to choose what percentage they want to live at this rate. I probably follow a diet like this about 85%. So I think that we try to teach these things, but we have to remember that people will adapt and adopt as much as is realistic into their own diets. The supplements we use are green superfoods. I'll show you one of the supplements that I highly use for this area. And other things like enzymes, liver supplements, and superfoods, which I'll also show you a picture of. We ask them to eat vegetables, whole grains, nuts, and seeds, and avoid all meat, fish, dairy, and eggs. Minimize canned, boxed, processed, refined, fried, charred, and overcooked. Very similar to what we did in the previous diet. There are people who will get their superfoods from foods, and then there are those who actually need to have something to take to add to it. I find this supplement to be really useful in this case. It's not labeled as raw, but it is a raw product, which means these are all active phytonutrients. It's also organic in glass and spectrophotometrically tested, which means every single raw ingredient is run through chemical spectroscopy so you don't have any contaminants. And actually, all of the products that I've mentioned are run through chemical spectroscopy, which sets them apart. There's only a handful of companies in the United States that are actually spectrophotometrically testing, and we know that contaminants are the major problem with supplements to begin with. But when you look at the dosing here, you're going to find that the organic green tea leaf, the ECGC, the catechins, and the polyphenols, they're all standardized to give you a full therapeutic dose in terms of anti-cancer effect. The resveratrol is also at the full therapeutic dose for the cardiac system. The turmeric is at the full therapeutic dose that has been studied for Alzheimer's. And it's got the cocoa bean, the raw cacao, the bee pollen. This is one of the things which I use. I would say that out of all of the things besides multi and omega, I would say that this is probably the thing that has one of the best therapeutic benefits in the long term, also in picking up the antioxidant function. And if you look at different greens products, you'll find that people have various different things. I would say this is probably one of the most complete products that you're going to find. And the therapeutic dose comes from 6 capsules, but if I have somebody with high levels of inflammation, I may even increase the capsule to 12 capsules. And even at 12, you can see that the price comparison is actually very competitive. There are other products that become very important in this process. One of the things that I use quite a bit is the Genesis juices, and these are various numbers of them. They don't really taste great, but we teach people how to utilize them by mixing them with other kinds of juices. Sun Food Superfoods, which I'll be showing you some pictures of. We use Premier Labs aloe, arborescence, and juice, and coconut oil, and Amazing Veal powders. We encourage them to buy from natural food stores, organic raw hemp, honey, almonds, things like that. These are the Genesis juices. These are wild harvested, which means that the ground they're grown on is 100 years protected from fertilizers and pesticides. Actually, this is better than certified organic, in my opinion. And then lots of the Sun Food Superfoods. We teach our patients to use these things because these are very strong at correcting antioxidant function and inflammation. They're also, along with the pure greens, I would say this is kind of our mix. Some patients will do well on one thing, some patients will do well on the other, but you'll find these things listed on the website, and you'll see these slides if you ever want to look at it. The specific instructions we give to these patients is that they may expect a little bit of fatigue initially, which will resolve. Generally, they may need to increase the amount eaten, especially protein, to compensate. They may expect an increase in bowel movements, but they should discontinue the bowel cleansing supplements if they have diarrhea, more than 5 stools per day. Most people do these detoxifications while working. These are not those crazy ones where you have to sit on the pot all day. Some of the possible positive effects include decreased aches, pains, arthritis, asthma, sinus allergy, sugar cravings, weight, and inches. And some of the possible temporary negative effects may include headaches, fatigue, dizziness, diarrhea, generally corrected by increasing fluid intake and increasing calorie intake, because these are not calorie-restricted diets. And I could say that also increasing hydration, and I didn't show you this product because it's not in the picture, but Premier has a wonderful pink salt which we use, which is very, very effective at remineralizing the body, and I actually use that also in my athletes. The results, I think we've already talked about: increased antioxidant function and decreased inflammatory markers. So this kind of brings us to the end of this webinar, and I'm going to be taking some questions. I appreciate the fact that you guys have attended this this evening at such a time. So I am getting some questions. They're coming in by this email mechanism, and what I'm going to do is take them one at a time. Okay, considering benzophenone type chemicals are all in sunscreens and is known to mimic estrogen, what do you suggest as a sunscreen? There is a company called Epicurean, which actually has a sunscreen that does not have benzophenones in it. It's relatively effective, and I would say that I would rather that people get sun than put that sunscreen on. So that would be the answer to that one. 7-keto DHEA for men as well. 7-keto DHEA has a different effect than DHEA. 7-keto DHEA has absolutely no ability to support the adrenal system. It has no conversion to testosterone or estrogen. It is mainly utilizable for weight, muscle mass increase, fat metabolism. So I may have a male on 7-keto DHEA and DHEA to support the rest of the system. So yes, for men as well. Dr. Patti mentioned berries, citric fruits are being alkaline, did not specify when fruits can be introduced in the program. So when we're doing the weight part of the program, we restrict their fruits to 2 servings a day. And a serving would be like a half an apple. So 1 apple is 2 servings. Normally we're recommending about 2 servings of fruits a day. Fruits are chock full of antioxidants, but we also have to remember that they have a very great insulin stimulating effect, and especially for those people who are sensitive to that, it can have a detrimental effect. Are egg whites acceptable when you're following a plant-based diet? No, but when you're following a lean protein diet where that quarter of the plate, that 25% of the plate is animal protein derived, egg whites are absolutely acceptable and are a very good source of protein. Again, why 7-keto DHEA instead of DHEA? I think I answered that. In a weight management program, you're interested in not having conversion to testosterone, or to estrogen especially. And do all dairy products such as yogurt contain casein? The answer is yes, but yogurt is one of the things that people have trouble with, so sometimes in limited quantities. I mean, all of this is taken to the nth degree when you have a very severe condition you're trying to reverse, and then people slowly come off of the 100% following and add in things as realistic. Do we have any other questions? I don't see any other questions. I want to thank you for your attendance and your attention today. If you you will find this webinar posted within, what, tomorrow? Within 5 days on the website, and if there's any questions, you can always direct them to MD Prescriptives and I will get a hold of them. Thank you very much.